I want to guide you through a few points on the self-help check questionnaire. First, let's talk about point 3, where I suggest you check to see if you might clench or grind your teeth. Gum recession exposes roots. Subsequent tooth flexing during chewing or clenching can break out small flecks of tooth right at the gum line, creating notches here. Bony bumps, most common just to the inside of your lower teeth, as well as bone growths in the middle of the roof of your mouth, are signs of clenching. Bone builds to support teeth from the forces you put on your teeth. Wear and chipping on the biting surfaces of especially your lower front teeth are another indication, as is a scalloped tongue. The more deeply scalloped your tongue is, the more serious your problem likely is. Likewise, if the scallops remain when you protrude your tongue, it is even a more serious indication your tongue is trying to move out of your airway at night.
Okay, now I'm going to put a mirror right up to your nose and check the patency of your airway on each side. I'm going to lightly push on your nose on this side, and I want you to breathe in and out so I can see the pattern. Oh, that's a good, nice pattern. You have clear airway there. Good. And now we're going to push on the other side and see if the pattern of vapor is big. Yes. So you have adequate ability to breathe through your nose. Good.
Where is the tip of your tongue at rest? Does it rest in the middle of your mouth or on the floor? Or even against or between your front teeth? Are your lips parted while at rest? The further apart your lips are at rest, the more severe your problem is. Also notice the turnout of this man's lower lip, another sign of mouth breathing. This person has a severely collapsed palate. Notice the shadow caused by the abrupt vertical walls in the center. You want the upper lip
To be at least 15 millimeters. You can measure it formally from right at the end of the nose down to the lip, right there, and you're hoping for 15 millimeters. He's a good 25 millimeters, so he has an adequate upper lip.
Are your cheekbones flattened or prominent? Are you tongue-tied? An often overlooked reason people have a lower tongue rest is when the little string of tissue that anchors the tongue to the floor of the mouth is too short, it is attached too closely to your tongue tip, or attached too closely to the front of the floor of your mouth. When considering treatment, it is good to know the frenum is nothing but the vestiges of embryonic tissue. It has few nerves and little blood supply. Midwives sometimes relieve this to some degree so babies can nurse. When a complete release is needed, it is not a do-it-yourself project. Tongue tie releases are so medically essential in order to enable children to learn to swallow correctly and develop optimal faces and airways that Brazil has mandated all children be checked and, if necessary, treated for tongue tie. You can see by looking at these images that it would be impossible for these tongues to form a vacuum seal with the roof of the mouth, which is necessary for optimal development, or to move in other ways most effective for sucking, eating, or swallowing. This person needed a tongue tie release and was effective partly because he carefully followed a specific therapy regimen beginning immediately afterwards. Without this, reattachment and scar tissue can result. To determine if you need a release, a therapist will measure the distance from the tips of your top front teeth to the tips of your bottom front teeth with your mouth fully opened. She'll call that letter X. She'll make the same measurement with your tongue tip on the spot and call that number Y. In order to move forward successfully with therapy, the second measurement, Y, should be at least 60% of the first measurement, X. In other words, she will multiply the first measurement by 0.6. Y must be the same or greater than this answer. It is possible to move forward if you can only open half of the distance, because muscles of the tongue can stretch, but your results will likely be less effective.
To see if he has full range of motion of his tongue, you can use a range of motion TheraBite like this. You just hook the notch on the lower teeth, measure on the top teeth, and see how wide open that is. He's got about a 52, 53 millimeter opening. Now go ahead, sir, if you will, and put the tip of your tongue on the spot, and then open as wide as you can. We're going to put the notch on the lower teeth, measure how far, and he's got about a 33. So there you go. Thank you. Another way to test what their range of motion is sometimes I just take a dental instrument, open as widely as you can. I'll measure from incisor to incisor tip, tip of the bottom and top teeth, and I'll kind of mark that with a thumbnail. Now put your tip of your tongue on the spot and open as wide as you can. And then I'll measure that, and it's about here. So he still has 60% opening. It's just a quick and dirty measurement that I do.
Do your tonsils partially obstruct your airway? Do you have a reverse swallow? Here's one way you can check.
I just pick up my air water syringe, but you can also use a spray bottle. I ask my client to grimace. Yep, show your teeth. I'm going to squirt some water in the corner of your mouth. You probably will need to suck back to get it where it needs to go, and then swallow. Keep your lips apart. Keep your lips apart. Okay, now does your tongue stay? You needed a second swallow there. Let's try that again. Keep really grimaced. Okay, put some water there. Suction it back. There, that's what I want to see. Now, did your tongue stay with the tip on the spot, or did it want to move forward a little bit?
It wanted to move forward.
Okay, so you have a slight reverse swallow.
You want to see your whole uvula, which is the tissue tag that hangs down in the center of your throat. The less you see, the more severe your problem is. But you also want to see a tall and wide airway. This young woman has a narrow airway as in the former two images, but at least she has great muscle tone. Another possible telltale sign you might have apnea is noting the red arches to either side of the uvula when you don't have a sore throat. This often means the tongue is beating up the back of your throat while you sleep.